The next speaker is Professor Amon from Vienna. He would like to report something about a special surgical technique, and with that, I hand over to you.
Thank you. We changed the subject. We now come to artificial iris and possible applications in the context of flange techniques. Techniques where you fluff a haptic or a thread with a cautery to fix a lens or an artificial iris. There is also an instrument for this purpose, which I would like to briefly introduce to you, namely the so-called forceps needle, which simplifies these maneuvers. In principle, with flanging, you can change the feel of a lens, or you can flange seams, which are made of proline and they form into a mushroom and can be fixed to the device. Of course, the same works with haptic ends. As you can see, there are of course different shapes. If you flange PMA haptics, it becomes as wedge-shaped cone-like as a mushroom. It becomes like a fungus when you braid a PVDF haptic or a pole seam. Here you can see now that you usually have to bring the haptics into the needle, the angle has to be right, and sometimes it stops and then you damage. And if you pull and have resistance, it can be that the feel or the seam slips out. And especially if you want to fix artificial iris, this is a disadvantage. This is here. For example, I have developed an instrument, a needle that has tweezers in the cavity. This can be used to perform sclerotomies, i.e. prepare scleral tunnels, grasp the material, pull it into the needle, and externalize it. So this is possible in one step. For this, you can now use a Canabrava technique with a suture where both ends are flanged. And now I would like to show you a technique in which I implant an artificial iris combined with a lens. Here's the punching, which is one with the matrix. Yes, I'm marking that. And now I'm going to put the lens on the back of this artificial iris. This is a lens with closed loops, 4 closed loops, and can bring the thread through first one loop, then through the artificial iris, then through the other loop, back through the artificial iris, and that on both sides. Here now the eye, extensive anterior vitrectomy, then the marking of the incision sites. And now a test to see if it is also easy to fold. This compartment of iris and lens now. The opening is a limbal incision 5.4 millimeters, and through this step, the first end of the suture is now externalized with the forceps needle. The second end of the suture is then also externalized. This is done with all 4 ends of the 2 seams. And then here's the final ending. Of course, you have to be careful that you don't get a mess, that it doesn't mix. But if you work in a controlled manner, it works well. And then the lens is folded through the 5.4 millimeters implanted. However, this works very well due to a slight resistance, and the whole artificial iris plus lens compartment then actually opens relatively controlled in the eye. If you now pull the individual threads, you can center the artificial iris very nicely. So, this is now brought into position in such a way that the system remains well centered at the end of the operation. Now the ends are shortened and flanged. It doesn't have to be stitched. I don't have to open the conjunctiva. It is only important that the flange is subtendinal, so that it does not erode through the conjunctiva. And at the end of the operation, you see a well-centered lens with a beautiful artificial iris. Yes, you can also look it up on a YouTube channel if you want to. Let's move on to the Yamane technique, i.e. a technique where a haptic end is flanged. I won't show you that exactly now due to time constraints. The advantages are that you have a shorter surgery because you only have to flange twice. With sutures, you have 4 points, which means it might do better centering, but it takes a little longer. In principle, both techniques are very easy to use. And now, I want to show you a technique, a Yamane technique here, an artificial iris again, which was implanted years ago with matrix, a very old one. I had to explant an anterior chamber lens. The cornea was decompensated and now wanted to bring a lens behind the artificial iris. As a result, the Saloon Door Technique, as I call it. 2 radial sections in the artificial iris. As you can see, this works wonderfully, and I can then bring the lens behind the rigid pupil as if through a saloon door, again with a forceps needle. Here are the perforations of the scleral tunnel. Forceps noddle snaps the end of the haptic, so I externalize an end, flange it. Now I can bring the lens behind the iris through the saloon door and see it. The artificial iris closes again, completely elastic, and remains nice and light-proof. After that comes the second end. Again, externalization of the haptics, flanging. Then the eyes filled in, and then I trimmed it and finally sewed in a callus. Yes, you can also look that up if you are interested. Saloon Door Technology. And last but not least, I would like to introduce you to refixation. Of course, lenses can also be refixed, especially in the capsular tension ring in the eye. I can pierce around the tension ring with a 6.0 Prolene seam first, behind the clamping ring, then over the clamping ring, and again with the forceps needle grab the suture end, pull it out. And if I have then fixed both ends scarily, then this lens hangs on the capsular clamping ring, and if you dye it well, is also well centered. I would like to show you this now with the help of an artificial iris. Here's a post-traumatic case, artificial iris off-centered upwards. Now I perforate the artificial iris again with this forceps needle. After I did the sclerotomy before, one end of the seam is already flanged, and the non-flanged end is now fed back into the needle to the forceps needle. Will be externalized again. Then you can see that the thread has already been shortened. Otherwise, you would be pulling there forever. Then you pull the thread for so long. You'll see in a moment, the other end of the haptics will now appear, the flanged end of the suture. And you see, the move is accomplished until this flange docks with the iris. After that, it doesn't slip through anymore because there is a much smaller opening. And then I can recenter that iris and put it in position. You see, it's under tension. That means, of course, I have to stretch this thread. So I'm going to use 2 tweezers. Episclerally under tension, I tighten and center the whole thing to grasp so that it doesn't slip back. Then I shorten the thread and flange again, and flange to the tweezers, i.e., very close to the conjunctiva, so that all the material does not slip back again. And you will see, now comes this flange, and you can fry through it until you have arrived at the tweezers. And then when you let go, you will see how this flange gets stuck on the sclera, but automatically slips behind the conjunctiva. Then the whole thing is positioned, and in the end, this artificial iris was very well centered again, with a fluted seam using the forceps needle. You can also look that up if you want. So in conclusion, I would say with the forceps needle, it's easier to grasp. And the big advantage of resistance is that it doesn't slip out again, regardless of whether it's a haptic or a seam. And so lenses, but also, as you have seen, in some cases an artificial iris can be fixed, positioned, and also centered very well. Yes, if you want to look something up a bit, I have also written a book about flanging techniques. It is also mentioned in it, and that was actually the purpose of my presentation. Thank you.